Organization. We will be joined by a special guest, the SAID chair that Dr. Tedros will introduce. Present in the room are WHO Director General Dr. Tedros, Technical Lead on COVID-19, Dr. Bruce Aylward, Special Advisor to DG and Lead on ACT Accelerator, Dr. Mariangela Shimao, Assistant Director General, Access to Medicines and Health Products, Steve Solomon, Principal Legal Officer, Dr. Joachim Hombach, SAGE Secretariat. Joining us remotely are Dr. Sumya Swaminathan, Chief Scientist, Dr. Kate O'Brien, Director, Immunization, Vaccines and Biological. Welcome all. Simultaneous interpretation is provided in the 6 UN languages, plus Portuguese and Hindi. And now, without further ado, I will hand over to Dr. Tedros for his opening remarks. Dr. Tedros, the floor is yours.
Thank you, Fadila. Good morning, good afternoon, and good evening. Wherever you are, I wish you a Happy New Year. In our first briefing of 2021, I want to take a quick step back and tell you what's going to be coming up in the next few weeks. The pandemic is still a major public health crisis. We're in a race to save lives, livelihoods, and end this pandemic, and I will share more on that shortly. However, WHO is not just fighting the pandemic. We're fighting numerous disease outbreaks across the world, picking up and analyzing hundreds of potential signals every week. And our work goes far beyond emergencies. We work to improve human health in all its aspects, from birth to old age. As shown in the past year, WHO is working day and night to accelerate science, provide solutions to challenges on the ground, and build global solidarity. This is as important for tackling the pandemic as it is for getting essential services back up and running again. From preventing mothers and their children dying in childbirth, to tackling silent emergencies like antimicrobial resistance and mental health, to the prevention, screening, and control of HIV, TB, malaria, and neglected tropical diseases. This month, for example, is Cervical Cancer Awareness Month, where WHO is working with partners around the world to accelerate the first global health strategy for the elimination of cancer. We have learned a lot in the last year, not least that health is an investment in overall development, critical for thriving economies and a key pillar of national security. Health cannot be an afterthought when we have an emergency. We must ensure truly integrated primary healthcare systems that effectively prevent, screen, and treat infectious diseases and non-communicable diseases like diabetes, cancer, and heart and lung disease. The latter collectively lead to the deaths of more than 40 million people every year. The COVID-19 pandemic has shown us once again how a new infectious virus puts those with underlying at highest risk of dying. And those countries that have high numbers of people with health conditions put extra stress on the health system. And we must work with those focused on the climate crisis, which directly impacts health. Ultimately, we need to invest in preparedness and surveillance to stop the next pandemic and ensure that everyone has access to quality health services. In the year ahead, scientists and public health experts from inside and outside WHO will continue to work with us to break down the latest science and innovations and putting forward solutions so that we can build back greener and stronger health systems. My one hope is that there is less politicking about health in the year ahead. We have entered a new phase of the pandemic, where solidarity is needed like never before. We are in a race to save lives right now, and as my colleague, Dr. Mike Ryan, said back in March last year, it's important in any crisis to act fast and have no regrets. Caseloads are so high in several countries that hospitals and intensive care units are filling up to dangerous levels. For some countries, during the recent holiday period and cold weather, people mixed indoors more, which we know is riskier and will have consequences. New variants, which appear to be more transmissible, are exacerbating the situation. We call on all countries to increase testing and sequencing of the virus so that we can monitor and respond effectively to changes. Ultimately, countries have to consider their epidemiological situation and take appropriate measures based on the data. It's a tough balancing act, but ultimately saving lives, protecting health workers, and health systems must come first. I know it's tiring, but it's many times worse for those working or being treated in an overcrowded hospital, or for people who have had their cancer treatment postponed. So we must act for the most vulnerable that need help right now, as well as minimizing contacts in this critical period. Governments must support people who have to isolate or quarantine. Just as governments have generated stimulus to keep economies going, it's important to find innovative ways to offer people the chance to isolate safely away from others. To break chains of transmission, we must identify and find those who are infected, provide the care they need, and help them truly isolate safely. We are in a race to prevent infections, bring cases down, protect health systems, and save lives, while rolling out highly effective and safe vaccines to high-risk populations. This is not easy. These are the hard miles we must tread together. But if we act together, we can win both races and get ahead of the virus, while also limiting the opportunity for the virus to mutate further and threaten the health tools we currently have. Last week, WHO issued its first emergency use listing for a COVID-19 vaccine, the Pfizer-BioNTech vaccine. And yesterday, it was also encouraging to see the AstraZeneca vaccine rollout begin in the first country. 1 year on from WHO issuing its first disease outbreak news report about this virus, more than 30 countries have started vaccinating their high-risk populations with various COVID-19 vaccines. The scientific community has set a new standard for vaccine development. Now, the international community must set a new standard for access. COVAX has been backed by 190 countries and economies, and I want to see all manufacturers channel supply to COVAX quickly so that rollouts can begin and those at high risk are protected around the world. We owe it morally to health workers everywhere who have been fighting this pandemic around the clock for the best part of a year, to vaccinate them all as soon as possible. People must come first over short-term profits. It's in countries' self-interest to shun vaccine nationalism. Vaccinating health workers and those at high risk of serious disease is the fastest way to stabilize health systems, ensure all essential health services are up and running, and that a truly global economic recovery can take place. I urge all governments to work together and live up to their commitments to equitable distribution globally, and all pharmaceutical groups to boost supply as quickly as possible and to fully participate in COVAX. The 100-100 initiative, driven by WHO, UNICEF, and the World Bank, is supporting over 100 countries to conduct rapid readiness assessment and develop country-specific plans for vaccines and other COVID-19 tools. So far, more than 90 countries have already completed the assessments, and our teams are working around the clock to ensure that governments and health systems are ready for global vaccine rollout. But we need consistent, predictable, affordable supply of safe and effective vaccines. Morally, economically, socially, and for global security, we must act together right now to ensure equitable rollout. Following the emergency use listing last week, the SAGE group met today to discuss policy recommendations for the use of the Pfizer vaccine. I would like to invite the chair of SAGE, Dr. Alejandro Cravioto, to tell us about the recommendations. The floor is yours, Alejandro.
Thank you very much, Mr. Director General, and a Happy New Year to you too. The Strategic Advisory Group of Experts on Immunization was established by the Director General in 1999, and it's comprised of 15 experts from around the world charged with providing independent advice to the WHO DG on all policy-related issues of vaccines and immunization. The group is very well balanced geographically and gender-wise. In June of last year, as we do with other vaccines, SAGE set up a working group for the COVID-19 vaccines that were being developed. The group consists of 26 experts from around the world in all different areas and have consistently been working for the past months at least 2-3 times a week to be able to help us develop a number of documents and issues that we have been reviewing at SAGE level. The first product of the working group was a values framework for allocation and prioritization, which was presented to the DG and approved in September of 2020, and then a roadmap of prioritization for the groups that should be set up for vaccination, which was also approved and disseminated in October of 2020. These documents have been translated to all the UN official languages, so the WHO official languages. And today we met to look into the approval of the WHO emergency use listing of the Pfizer-BioNTech mRNA COVID-19 vaccine. The meeting was initiated with a review of the current situation of the COVID vaccine development pipeline, and of course the issues related to these SARS-CoV-2 virus variants, which is something that is worrying everyone. We looked at the global, regional, and country level plans for COVID vaccine safety monitoring, and we looked at the safety and efficacy data from phase 1 to 3 clinical trials of the Pfizer-BioNTech mRNA COVID-19 vaccines, BNT162b2. This was presented by the Pfizer and the BioNTech experts and was discussed by the SAGE members and the members also participating in the session. We deliberated and came out with the following recommendations. SAGE recommends the administration of 2 doses of this vaccine within 21 to 28 days. While we acknowledge the absence of data on safety and efficacy after 1 dose beyond the 3-4 weeks studied in the clinical trials, SAGE made a provision for countries in exceptional circumstances of vaccine supply constraints and epidemiologic settings to delay the administration of the second dose for a few weeks in order to maximize the number of individuals benefiting from a first dose. In the case of the anaphylactic reactions after administration of the Pfizer vaccine that have been reported outside of the clinical trials, SAGE recommended that the vaccine should be administered only in settings where anaphylaxis can be treated. So we provided a specific narrow exclusion for vaccination and on the observation period, as well as the management, monitoring, and reporting of any safety events. We recognize the importance of vaccination of pregnant women, especially given the priority for protection of health workers, of whom a large proportion globally are, of course, women. Nevertheless, in light of the data limitations, SAGE was not able to provide a recommendation for the use of the vaccine in pregnancy until more safety data are available. However, we made a provision for situations where a benefit of vaccination of a pregnant woman outweighs the potential risks, such as health workers at high risk of exposure. We have done this before for other vaccines, as the use of the Ebola vaccine in the Democratic Republic of Congo before. SAGE acknowledged the lack of data for recommending the vaccine to lactating women, and given the importance of breastfeeding, we encourage the companies to be able, or the company to be able to bring information necessary for us to make a decision in the near future. As with the case of the pregnant women, we have also made a provision in which if a woman is part of a high-risk group, then we recommend the vaccination without the stopping of the breastfeeding. In the case of persons, SAGE recommends that COVID vaccination be offered regardless of a person's history of asymptomatic or symptomatic SARS-CoV-2 infection. Available data currently indicate that symptomatic reinfection within 6 months after an initial infection is rare. Thus, in the context of limited vaccine supply, persons with a PCR documented SARS-CoV-2 infection in the preceding 6 months may choose to delay vaccination until near end of this time period. This would encourage the use of the vaccines for other people who have not been exposed to the virus and thus have a much larger portion of the population protected. As noted in the prioritization roadmap, SAGE re-emphasized that national programs should take specific steps to identify groups that are proportionally affected by COVID-19 and those who face health inequities due to social, structural inequities in order to address barriers to vaccination and achieve equitable access to the products. In the current period of very limited supply, preferential vaccination of international travels would counter the principle of equity. Because of this and the lack of evidence to inform whether vaccination reduces the risk of transmission, SAGE currently does not recommend COVID-19 vaccination of travelers unless they are also part of a high-risk group identified within the prioritization roadmap. SAGE recommends the continued post-authorization monitoring of COVID-19 vaccines for effectiveness and safety, and listed multiple specific areas of additional research on COVID-19 vaccines, such as vaccine efficacy against SARS-CoV transmission, duration of protection, vaccine efficacy against the virus variants, vaccine efficacy and safety in children younger than 16 years old, immunogenicity and safety, and especially co-transmission with other vaccines and vaccine interchangeability. This is important, especially with the co-administration for the elderly group with an influenza vaccine, if that were possible. In the coming weeks and months, we will continue to review the other vaccines as they become available and with the data coming from the manufacturers when made available for these deliberations and as part of the regulatory processes are undertaken. The recommendations have been sent to the DG for approval, and once this has been achieved, then we will publish them in the weekly epidemiological record in a few weeks, so that everybody is aware of this first approval of the COVID-19 vaccine. I would leave it there, sir, and see if there are any questions that somebody would like to ask. Thank you very much.
Muchas gracias, Alejandro.
De nada, señor.
Every country needs to row in unison in the same direction to beat this pandemic. Solidarity, multilateralism, and collaboration are key so that we win the race against this pandemic quickly and escape the stormy waters together. Lastly, over the past 24 hours, members of the International Scientific Team on COVID-19 virus origins began traveling from their home countries to China. This was as per arrangements jointly developed between WHO, the Chinese government, and the countries for which the team was meant to travel through on their way to Wuhan. Today, we learned that Chinese officials have not yet finalized the necessary permission for the team's arrival in China. I'm very disappointed with this news, given that 2 members had already begun their journeys and others were not able to travel at the last minute. But I have been in contact with senior Chinese officials, and I have once again made it clear that the mission is a priority for WHO and the international team. I have been assured that China is speeding up the internal procedure for the earliest possible deployment. We're eager to get the mission underway as soon as possible. I thank you, and once again, Happy New Year. Fadila, back to you.
Thank you, Dr. Tedros, and thank you, Dr. Craviotto. I will now open the floor to questions from journalists. I remind you that you need to raise your hand, use the raise your hand icon in order to get in the queue. I would like now to invite our first journalist, Christine Teodoro.